You should always learn the latest technology. Don't be the judge. The future will decide whether the technology was right or not so right. So my duty as a surgeon is to learn what is available and offer that to my patients. Let the patient have the final choice in deciding what he wants to get done. So just because I am not abreast with the latest technology, I am not offering him something, is something I believe is not correct. If something is available, I should be ready to offer it, and Ruben is also offering it. When the SSI system was installed, the SSI team gave comprehensive training to all of us. Then we were certified by SSI. And when we posted our first few cases, Dr. Magan sir was our proctor. He is himself a pioneer and perhaps a legend also in robotic surgery. So he came to our hospital and he proctored for the first few cases, including complex hernias. So that is how I and the hospital began our robotic program. And now we are comfortable doing it individually by ourselves. Mantra, I feel, is at par with any other system. Few people are skeptical when it comes not particularly to Mantra, but robotic versus laparoscopy. So what my experience is that port size is not everything. If even with a slightly larger port, if the patient is pain-free due to the blunt trocars, minimal abdominal torque, because all the movements are happening within the abdomen. So definitely patient-wise, what patient feedback is that they are almost painless even an hour or two after the surgery, which is not there with laparoscopy. So that is what got hooked me to robotic surgery from the patient point of view. From surgeon's point of view, enhanced 3D vision, very precise movement. So these things aid in a better surgery, better patient outcomes, more precision, and especially for pelvic surgeries when we are doing complex hernias or in upper GI cases where like fundoplication. So when the working space is limited, the enhanced precision definitely has a role over. How I look at it is, I am sitting on this side of the table. So I have formed a robotic surgery support group where patients who have undergone robotic surgery by me, whoever comes with the same complaint and who is about to be planned for the same surgery, I get him contacted by the person who has already went through the entire experience. So because they are sitting on the other side of the table, so they will be more convinced by the patient's feedback. I am obviously there to tell the benefits, but finally the option on what treatment the patient wants to undergo is entirely his. So a patient-to-patient feedback definitely helps. The training was definitely up to the mark, and SSI definitely provided a comprehensive training with all the instruments, especially the control of the master clutch, camera, how to go about it, regarding the theories of board placement, everything, movement. So it was pretty comprehensive, I would say. Everyone has to learn robotic surgery, whether they do it today, 2 years later, 5 years later, but definitely everyone, the future and the present is robotics. We are there to provide whatever treatment options are available presently, not only in India, but in general, whatever available technology is there. It should be the right of the patient to choose what he wants to undergo. Surgeon not knowing a particular technique or a particular surgery should never be the limiting factor in his treatment.